So I'm going to give you a sense of what I believe this budget was all about. I call this the marginal revolution budget, largely because the finance minister has stuck to small changes in the system, which will go towards long-term efficiency enhancement of the economy overall. Beginning with giving statutory backing to Aadhaar, I think it's a very good deal, not just because subsidies are now going to be done through the Aadhaar platform, but also because it's one of those enabling, facilitating institution which will be helpful even in the mainstream sectors. Beyond that, the transfer to the Gram Panchayat and the urban local bodies stands out as a very significant development because fiscal federalism is largely being concentrated on movements from the center to the states in terms of resources. But this is really talking about enhancing the capacity at the local levels, which means that at the village panchayat level and the urban local body level, which is very important if we are to realize the smart cities promise of India. The emphasis on digital literacy is again a very important emphasis, because eventually, given the shortage of physical infrastructure, we will have to rely a great deal on digital connectivity on many counts. So that again is a good move. The comprehensive code for insolvency and bankruptcy in India is again going to be one of those small but very significant changes which will help untrap both resources in terms of capital as well as human resource, which are stuck in bad firms. So it helps dissolve firms and move on. The resources get reallocated across the economy in a much more efficient way. So these are the broader set of small changes which I think will lead to long-term growth and development. But the large emphasis on agriculture is very welcome because there has been a concern about growing agrarian distress in India over the last 2 years because of the two failed consecutive rain, the droughts in the country. Emphasis on food processing again is very welcome. The great emphasis on irrigation facilities. Now the details there will be in implementation. Beyond allocating resources for irrigation, we will have to see how much really gets implemented in terms of enhanced capacity. The emphasis on crop insurance, I think, is, while it is very important to give this kind of a surety or a financial instrument that helps farmers smooth consumption, but I think unless they index it to the weather or rainfall, the fear is that we might go the way most other countries have in case of crop insurance, that it just becomes an unsustainable financial instrument. In terms of infrastructure, the capex and increase in roads, airports, railways, excellent move. I think enough research has been generated. Given the NDA-1 under Vajpayee, the kind of investments they made in infrastructure, those are the benefits that we are still reaping. A large part of our last decade's growth is attributed to roads. It leads to social mobility, it leads to economic mobility, and eventually this is what trickle-down is, that growth has to go beyond certain metropolis and certain sectors. It has to be far wide-reaching. The banking sector, I know that there's a concern within the industry that it's not enough. 25,000 crores is obviously, it's peanuts compared to the total amount that is required to bail out this sector. But I think it's a good thing that the government hasn't gone out for an all-encompassing bailout, because that really does send a wrong signal across. We have seen out of the 28 public sector banks, many of them are sitting with large NPAs because due diligence was compromised. The NPAs are on account of a lot of poor governance within these banks. So I think this amount is just enough to push them towards mergers and consolidation. So it would be fine to see some banks go under, get acquired by the better run banks. That's how markets evolve, and I think that is the healthy way to go about it in any case. In terms of healthcare, again, insurance is the choice instrument that the finance minister has stuck to. And in my view, it is a low-hanging fruit. It's easy. I mean, of course, the budget concerns are significant, but it's easier to do this given how difficult it is to enhance primary healthcare and secondary healthcare within the country. But a financial instrument is only as good as the physical infrastructure or real delivery of healthcare that backs such financial instruments. So I'm just wondering whether, access to insurance or better health insurance is really going to do much, given that primary healthcare is largely absent in, out of the metropolitan areas in the country. So we need to put some emphasis back into that. Acquiring drugs through these new drug centers, shops that are going to be, these are all again good moves, but they are quite marginal if you look at the overall healthcare concerns in India. The problem is too large, and these are very small steps, so not enough in healthcare. In education, I was very happy to note that we don't have new announcements of IITs and AIIMS across the country, because we have seen that over the last 10 years we've had many announcements, and most of these IITs and IIMs are either very poor quality or they just have not taken off, largely because of shortage of faculty, which means we have to nip this problem in the bud. We have to have more R&D, we have to have more PhDs, we will really have to train our faculty to go out and then do this kind of technical education which is required for creation of centers of excellence. So there was nothing in the budget which put emphasis on R&D. What kind of resources are required? We've had a lot of research showing that India really lacks in R&D capacity, both in terms of capital as well as, again, human resources. This budget, unfortunately, did not look into those aspects. Within education, I think the emphasis remained largely on training and skill development and really employability. These are all very good. I think it is much needed. But here again, I was very happy to note that we are going beyond the NSDC model of basically doing a top-down training of people through subsidized government schemes, basically giving you education loan or training loan, so that then you go and get trained and then you seek a job and you pay off these loans. It has not been working. NSDC has trained too few people, and a lot of these people who have been trained do not have jobs. So this budget talked for the first time about incentivizing employment creation. I'm quite happy with that move, because eventually I believe that firms that create jobs really do they do a certain service to the economy, and this really is the only long-term sustainable way to increase employability and train labor within the economy. Now, on the gender front, while many might not see anything in this budget on gender because the finance minister didn't mention it, but here we have to make a note that the provision of LPG or cooking gas to 5 crore women over the next 2 years is going to disproportionately benefit women, largely because indoor pollution is one of the biggest killers of women, and this is, this LPG is really going to impact women, because it's, the social cultural practices means it's mostly women and little children who are impacted by indoor pollution. Then again, the emphasis in Stand Up India on youth and women is also a welcome move, because this will mean that women entrepreneurs will have access to not just credit, but also some amount of training and access to markets, which is, again, it's welcome. But I'd like to wrap up my overview of this Budget 2016 by making a very simple distinction between what the role of a finance ministry is vis-a-vis the separate ministries. So when we see some health or education underrepresented in the budget, or there isn't enough clarity or not enough resources allocated, I think the one way to understand this is to see that these ministries have been lacking in vision and blueprints. They really haven't come out with the kind of demand for more resources. It would be great to pull out the national, health policy draft out of the freezer and talk about it. What would it take? What kind of resources do we need from the finance ministry to make that national health policy a reality? And if there's enough, clarity from the health ministry, then my guess is that it's an informed decision by the finance minister to then either give or not to give to the health sector. But as of now, I think the emphasis that is missing on health and education is largely due to the missing capacities within these ministries. But on the whole, I'm actually quite happy with the budget. Thank you.